This next section, body cavities and body regions. Think about your body, especially the torso, as kind of like the box that you get electronics in. Okay, you know how electronics are always packaged really tightly together, and there's like the electronic thing has like a little protective layer on it, and then it's in a little plastic bag, and then the plastic bag is inside like a little square of triangle of cardboard that's like folded really carefully to hold the electronic thing in place, but also all of the other things like the cord and the headphones, and because you need another set of earbuds that always comes with it. And all of those things are in their own little pockets, and it's all packed so tightly together that even in shipping and jumping around with it, it doesn't move and it doesn't get damaged. Your body is actually packaged the same way. So let's talk about what we mean at this. So body cavities are spaces inside the body that are separated by thin layers of tissue. Those tissues are usually called membranes. The two main parts of the trunk of the body are the thoracic cavity and the abdominal cavity. Those are the two that we're going to talk about most often. So this is a side view, a sagittal section of the body, and this is a front view, a coronal section of the body. I know we already learned those, isn't that cool? Okay. So you can see this thoracic cavity contains this whole portion, and the abdominal cavity is this dark red portion here. This is one place where, rather than a thin membrane of thin connective tissue, we actually have a muscle separating these two cavities, and that's the diaphragm. Your diaphragm is actually the main muscle that you use for breathing, and that's your diaphragm right there. Also, if you like carne asada, it's the most common cut of meat used to make carne asada is actually the diaphragm, which in a cow is called a skirt steak because it's a thin sort of umbrella or skirt-shaped piece of meat. There you go. All right, so the thoracic cavity is this upper part. It has another cavity inside that holds the heart. That's called the pericardial cavity. Peri means around. Cardial refers to the heart. So this cavity goes around the heart. And then we have the pleural cavities that hold both lungs. And then we have a little space between them called the mediastinum or the mediastinum. Now the abdominal cavity is going to hold all of your digestive organs, and then there's a thin layer of connective tissue that's going to separate it from the pelvic cavity, which holds the reproductive organs in the female and some of the reproductive organs in the male, some accessory structures. The urinary bladder is also in the pelvic cavity. Okay, notice that when we talk about the abdominal cavity and the pelvic cavity together, we smush these two words together to make abdominopelvic cavity. So this is a really important way to create a new term when we're talking about two things together. We make them both adjectives, take the end off the first one, replace it with an O, and then smush the two words together. Abdominopelvic. If you refer to the abdominal pelvic cavity, that is incorrect. It's the abdominal cavity, the pelvic cavity, and together they make the abdominopelvic cavity. Okay, very, very important. Now, in the abdomen, we can divide the abdominopelvic cavity into 9 regions. Some of the terms you need to know: hypo means below. So right and left, we have a hypochondriac region. Chondriac comes from the word chondro, that means cartilage. So the hypochondriac region is not constantly complaining about its health. It's actually under this cartilage here, which is the cartilage that connects the ribs to the sternum. That's that bone right there. In between those two, we have the epigastric region. Epi means on or on top of, and gastro means stomach. So here's the stomach right here. The epigastric region is kind of on top of the stomach. Under that, we have the umbilical region. That's where your belly button is. That's where your umbilicus was. And to the right and left of that, we have the lumbar regions. This portion of the vertebral column has the lumbar vertebrae. It's called the lumbar section. So these are the lumbar regions. And then we have the hypogastric region in the middle, down below, which is under the stomach. I know it's not the greatest name, but that's what it's called. And then we have the right and left iliac region. This bone here, making the hip, the top part of the hip, is called the iliac bone. So these regions are named for the iliac bone. Notice there is only one L in iliac. It's I-L-I-A-C, not I-L-L. Okay, everybody always wants to put two L's in it. All right, so we've got right and left hypochondriac, right and left lumbar, right and left iliac, and then in the center, epigastric, umbilical, and hypogastric. Now, for those of you who are thinking, hang on, the right is on the left and the left is on the right, I'm not talking about your right and left. I'm talking about the right and left of the person we're looking at. So this is that person's right side and that person's left side, which is always how we name anatomic things, okay? When you're looking at your own body, your right hypochondriac is going to be on your right side. When you're looking at somebody else, their right hypochondriac region will be to your left. Now, much easier than the regions are the quadrants. There are 4 of them because quadrant, right upper, right lower, and left lower. Isn't that great? God, I love the quadrants. Okay, now, we also need to know the names of some of the areas on the body. And this is the diagram from your textbook. And honestly, that's too much. You know, we're going to get back to it and we're going to learn all of these eventually, but we don't need to know all these right now. So let's shorten it. These are the ones I want you to know right now. A couple of these we've already talked about. Cranial, surrounding the brain. The cranium are the bones that surround the brain. Cephalic means head. Notice this is not phallic, referring to the male pubic organ. That would be P-H-A-L-L-I-C. Cephalic refers to the head, okay, and that's the whole head. Cervical refers to the neck. Yes, I know. A woman has a cervix, which is the neck of the uterus. I know, right? Okay. Axillary means armpit. Notice it is A-X-I-L-L. Axial, A-X-I-A-L, refers to a central axis. Okay? Totally different. Axial is the armpit. Brachial refers to the arm, especially the upper arm. Antecubital refers to this front part of the elbow. We sometimes call it the cubital area or the cubital fossa. Palmar refers to the front of the hand. Digits are fingers, so anything having to do with the fingers are digital whatnots. Thoracic, this whole area is called the thoracic area. We knew that. Abdominal is where the abdominal and pelvic regions are. We knew those too. And then both the thoracic and the abdominal areas reach around to the back as well. Then we have the lumbar. We already met that one. That's those vertebrae, the lower part of the vertebral column. The pubic region has the pubes, the pubic structures. The back side of the hand is called the dorsum, or the dorsal side of the hand. Okay? Dorsum is the noun, dorsal is the adjective. The dorsum of the foot, notice, is the top side of the foot. Okay, so this can be confusing. The dorsum of the hand is the back side, the dorsum of the foot is the top side. Think of a quadruped animal with its hands and feet on the ground. The dorsum of the foot and the dorsum of the hand both face up toward the dorsal side. That's where that name comes from. Digits, again, refers to the toes and the fingers. The back of the knee is called the popliteal area. The plantar side of the foot is the bottom. Okay, so in anatomy, we don't call it the sole of the foot, we call it the plantar side. And then calcaneal refers to the heel. And your main bone in your foot, this big bone here that makes up the heel, is called the calcaneus. And it connects to your muscle here, your calf muscle, with a calcaneal tendon, which you probably know as the Achilles tendon. Okay, let's practice our directions a little bit. The axillary part of the arm is at the proximal end of the arm. It is proximal to the brachial region. The brachial region is proximal to the antecubital region. The antecubital region is distal to the brachial region. Hopefully these make sense. The let's see, what do we have for medial lateral? The antecubital part of the arm is lateral to the abdominal area and the belly button, the umbilicus. Make sense? All right. We'll finish up one more in just a second.